it's not just that we are connected to nature, we are nature, and sometimes we forget that. It's crazy. But we are a part of the ecosystem.
Hello and welcome. Today's guest is part clinician, part ecologist, and part anthropologist. In 2000, she founded Whole Family MD, San Francisco's first integrative primary care practice, which is still going strong. And she's the author of The Jungle Effect and Farmacology, What Innovative Family Farming Can Teach Us About Health and Healing. Please welcome with me, Daphne Miller.
Thank you so much.
Yeah, thank you. You know, the first thing that I think of when I hear farming is like big farm. What does that have to do with me as an individual and the part that I can play, and how does that play in individual health?
Absolutely. I mean, this project started for me because I realized how connected our health is to farms, and not just the food that comes from those farms, but from the soil and the air and the water that's used on the farms. And so I decided to head out and actually learn from the healers who work on those farms, who are farmers. And what I learned is that even if we live in the city and have never been to a farm in our life, that in fact our health is completely dependent on what takes place on the farms and all the choices that the farmer makes. And I, in pharmacology, spend a lot of time talking about all those connections, how our immune system is really very much tied to the immune system on the farm, and specifically the microbes on the farm, how the nutrients that we get are tied to how well the nutrients are produced from that soil on the farm, and some soil is very depleted and other soil is not. And I go into that in detail. And I talk a lot about how farms actually do way more than nourish us physically, that they provide a lot of community as well, and specifically urban farming. And I also focus on how our system of agriculture can either harm the planet in terms of creating greenhouse gases and so on, or heal the planet, in terms of actually being a wonderful form of carbon storing.
Yeah, so you're part of a movement, Healthy Parks, Healthy People, and this initiative. Tell me more about that, please.
Yeah, so that's actually, it's what I do with that work is actually, I have been working a lot with rangers and people who take care of our public lands. And the idea is for us to think about all these public lands as part of our healthcare system and actually being this amazing health resource. And so in pharmacology, I wrote a lot about farms and their impact on our physical health. But with this Healthy Parks, Healthy People movement, it's looking at everything from our trails and our forests and our streams and how they also impact our health, even if we choose never to go hiking in them. They act as these wonderful secondary lungs that filter out pollutants. They filter nutrients, or they actually provide nutrients in the water and filter out pollutants from the water. They protect all these species of animals that have everything to do with our health. And they also are these wonderful places for us to go and exercise and get mental peace. There's a lot of research showing that the amount of exposure you have to greenness has everything to do with your, how positive a mood you're going to have, and even how quickly you're going to recover from things like surgery and so on. Yeah, which is why hospitals are moving towards greening and so on. So I really do look at greenness as a vital sign.
To bring this on an individual level, like what can people do to be a part of this?
Well, there's so much that can be done. And what I really try and get people to understand is that it's not just that we are connected to nature, we are nature, and sometimes we forget that. It's crazy. But we are a part of the ecosystem. And so every choice that we make is going to be part of that larger feedback loop. For example, if we put things on our body or use them to clean our house or our car that are dangerous to animals or to the microbes in the soil, the healthy microbes in the soil, then in fact what we're doing is harming ourselves in the long run. And not only that, that stuff's going to get incorporated into our food and we're going to eat it. So I always tell people, don't use anything that you're not willing to eat. Think of it as something that's going to come back to you in some form or another.
So when someone is looking for a farm that treats the land responsibly, what should they be looking for? What questions should they be asking?
Well, there's a couple really important questions. And actually the most important question I feel is, does the farmer live on the land and eat from that land? Because 20 years ago, there were farmers who just didn't know and were destroying their soil and putting all kinds of herbicides and pesticides on their soil, and then, that was their land. But now, most farmers who really are local and living on their land are treating it as if it were a member of a family. And most of the toxic land that we're making in this country is owned by people who don't even they're businessmen who live in a city somewhere, So that's a really important first question, is that farm a member of your family?
Okay.
And then asking them, what's your system of farming? Do you do a regenerative or eco or sustainable model where you don't use a lot of external inputs and are really recycling all your nutrients back in the soil, composting, using animals for compost, using local seeds, conserving water, not plowing the land so that the soil flies into the air and off into the streams? And those are all these really important steps. And I think once we become farm literate, then we're really able to have these conversations and go home and read about the farm. Oh, those peaches are from Sunnyvale Farm. Let me go read about Sunnyvale Farm. And you can start to learn a lot about it. And I really do want people to care about that.
You have your own home garden.
I do.
So tell me what all you have there, and it sounds amazing, but I love food, so.
Yeah, well, this year we're having a horrible drought in California, so I've learned how to be a dry gardener.
Oh, that sounds interesting.
And so there's things you just can't grow, like berries. If they make it, great, but I'm not watering them. And there's also other things that are going to be a little bit more shriveled, but maybe more hardy and nutritious as a result of it, like my tomatoes. But the way that I garden is very much, for me, I'll come home from my clinical practice, and before I even start to make dinner for my family, I'll go out and tend it a little bit. And I do it every day for maybe 10 minutes. I never garden for more than 10 minutes. My husband calls it flash gardening. And that's all you really need is, there's a saying that the most nutritious thing for a garden, or the most nurturing thing for a garden is the shadow of the gardener. And so I try and give that shadow every day for about 10 minutes. And my garden, it's not big, but it does a lot of good work for me and my family.
Thank you so much for all of this. So enlightening. Okay, everybody, if you would like to watch more interviews with Integrative Nutrition's visiting teachers, please subscribe, and thanks for watching.
I think it's mandatory to have somebody, as a physician, it's mandatory to have somebody in your office that you can hand the patient off to support them. Because the how-to part is, it's everything, and so that's the role that a health coach plays.